Ever felt a bit uncomfortable, itchy, or even a bit sore down there, in the back passage? Don't worry, you're not the only one. Loads of people have hemorrhoids, millions around the world, in fact. It can feel a bit embarrassing to talk about, but it's really important to understand what's going on and get some help if you need it. So, hemorrhoids are basically swollen veins like varicose veins, but down below in the bottom. They occur when the veins in the lower rectum or anus become swollen and inflamed. This can happen due to various reasons, such as straining during bowel movements, increased pressure during pregnancy, or even sitting for long periods of time. Hemorrhoids can be quite uncomfortable, and sometimes even painful, but they are a common condition that many people experience at some point in their lives. There are two main types, internal ones and external ones. Internal ones are inside and don't always hurt but can bleed a bit. These hemorrhoids are located inside the rectum and are usually not visible. They can cause painless bleeding during bowel movements, which might be the only sign that they are there. Sometimes, internal hemorrhoids can prolapse or extend outside the anus, which can be uncomfortable and may require medical treatment. External hemorrhoids, on the other hand, are under the skin and can be a bit painful and itchy. These ones form under the skin around the anus and can cause significant discomfort. They can be itchy, painful, and may even bleed. In some cases, a blood clot can form in an external hemorrhoid, turning it into a thrombosed hemorrhoid, which can be very painful and may require medical intervention to relieve the pain and swelling. Loads of people get them, over half of us by the time we hit 50. Hemorrhoids are incredibly common, and it's estimated that about 75% of people will experience them at some point in their lives. They can affect anyone, but they are more common in older adults. Factors such as obesity, a low-fiber diet, and chronic constipation or diarrhea can increase the risk of developing hemorrhoids. It's nothing to be ashamed of, but it's good to know how to deal with them. If you suspect you have hemorrhoids, it's important to seek medical advice to get a proper diagnosis and treatment plan. There are various treatments available, ranging from over-the-counter creams and ointments to more advanced procedures like rubber band ligation or surgical removal. Maintaining a healthy diet, staying hydrated, and practicing good bathroom habits can help prevent hemorrhoids from developing or worsening. Remember, you're not alone, and there are effective ways to manage and treat hemorrhoids. Lots of things can cause hemorrhoids. One of the most common is pushing too hard when you go to the toilet, especially if you're a bit bunged up. When you strain, it puts pressure on the veins down there, making them swell up. Other things that don't help are having the runs a lot, being pregnant, sitting down for ages, especially on the loo, lifting heavy things and not eating enough fiber. Being overweight can make it more likely too. Hemorrhoids can be a real pain, literally. You might feel uncomfortable or sore, especially when you're doing a poo or sitting for a while. Itching or feeling a bit raw around the back passage is another common thing. You might even feel a lump or swelling, and sometimes they can bleed a bit, especially when you go to the toilet. You might see a bit of bright red blood on the toilet paper or in the bowl. The good news is that most of the time, you can ease hemorrhoids with simple things you can do yourself. Hemorrhoids, which are swollen veins in your lower rectum and anus, can be quite uncomfortable and sometimes even painful. However, with some lifestyle changes and home remedies, you can manage the symptoms effectively and even prevent them from occurring in the future. One of the best things you can do is to eat more fiber. Fiber is essential for maintaining a healthy digestive system. It adds bulk to your stool and makes it easier to pass, which can help reduce the strain that can cause hemorrhoids. Fiber makes your poo softer and easier to pass, so you don't have to strain. Straining during bowel movements is one of the main causes of hemorrhoids, so by making your stool softer, you can significantly reduce your risk. Try to eat plenty of fruits, veggies, and wholemeal bread. These foods are not only rich in fiber, but also packed with essential vitamins and minerals that support overall health. Incorporating a variety of these foods into your diet can help keep your digestive system running smoothly. Drinking lots of water is really important too, as it helps to soften things up. Staying hydrated is crucial for maintaining soft stools and preventing constipation. Aim to drink at least 8 glasses of water a day, and more if you're active or live in a hot climate. A warm bath can also be really soothing. Soaking in a warm bath for about 15 to 20 minutes can help reduce the swelling and irritation caused by hemorrhoids. The warmth of the water can also promote blood flow to the area, which can aid in healing, especially a sitz bath where you just sit in warm water up to your hips. A sitz bath is a special type of bath that targets the lower part of your body. It's particularly effective for hemorrhoids because it allows you to soak the affected area directly, providing relief from pain and itching. You can do this several times a day, especially after bowel movements, to keep the area clean and reduce discomfort. Another helpful remedy is applying a cold compress to the affected area. This can help reduce swelling and numb the pain. Simply wrap some ice in a cloth and apply it to the hemorrhoids for about 15 minutes at a time. Be sure not to apply ice directly to the skin, as this can cause damage. Over-the-counter creams and ointments can also provide relief. These products often contain ingredients like hydrocortisone, which can reduce inflammation and itching. Be sure to follow the instructions on the packaging and consult with a healthcare provider if you have any concerns. Gentle exercise can also be beneficial. Activities like walking, swimming, or yoga can help improve circulation and reduce the pressure on the veins in your lower rectum and anus. Regular physical activity can also help prevent constipation, which is a common cause of hemorrhoids. Finally, sitting on a cushion can help alleviate discomfort. If you have to sit for long periods, using a cushion can reduce the pressure on your hemorrhoids and make sitting more comfortable. Look for a cushion with a hole in the center, often called a donut cushion, which can provide extra relief. By incorporating these simple at-home remedies into your daily routine, you can manage and even prevent hemorrhoids effectively. Remember, if your symptoms persist or worsen, it's important to seek medical advice. Taking care of your digestive health is key to overall well-being. While those home remedies often do the trick, it's important to know when to see a doctor. Sometimes, despite our best efforts with over-the-counter treatments and natural remedies, our symptoms persist or even worsen. This is when professional medical advice becomes crucial. Ignoring persistent symptoms can lead to more serious health issues down the line. If things are really bad, don't get better with the home remedies, or if you're bleeding a lot, go and get checked out. It's always better to be safe and get a professional opinion. Doctors have the expertise to diagnose underlying conditions that might not be apparent to us. They can perform tests and examinations that are beyond the scope of home care. Your doctor can see how bad they are and suggest the best treatment. They can provide a tailored treatment plan that addresses your specific condition. This might include prescription medications, lifestyle changes, or other interventions that you might not have considered. It's important to follow their advice closely to ensure the best possible outcome. For more stubborn cases, there are a few things they can do. Medical professionals have a range of tools and techniques at their disposal to treat more severe or persistent conditions. These treatments are often more effective than home remedies and can provide quicker relief. Your doctor will discuss these options with you and help you decide on the best course of action. One option is called rubber band ligation, where they put a tiny band around the hemorrhoid to stop the blood flow. This procedure is minimally invasive and can be done in the doctor's office. It effectively cuts off the blood supply to the hemorrhoid, causing it to shrink and eventually fall off. Patients usually experience significant relief after this procedure. Another is sclerotherapy, where they inject something to shrink it. This involves injecting a chemical solution directly into the hemorrhoid, causing it to shrink and eventually disappear. Sclerotherapy is a quick procedure and is often used for smaller hemorrhoids. It is generally well tolerated and has a high success rate. Surgery is usually only for the really bad cases. When other treatments fail or the condition is particularly severe, surgical intervention might be necessary. This could involve removing the hemorrhoid or other more complex procedures. Surgery is typically considered a last resort due to its invasive nature and longer recovery time. However, it can provide a permanent solution for those suffering from chronic or severe symptoms. Always discuss the risks and benefits with your doctor to make an informed decision. It's always better to avoid getting hemorrhoids in the first place. And the good news is that a few simple changes can make a big difference. We've already talked about eating plenty of fiber and staying hydrated. Try not to push too hard when you go to the toilet. If you're constipated, don't force it. You could try a gentle laxative from the chemist. Regular exercise, even just a walk every day, can help keep things moving too. Let's clear up a few myths about hemorrhoids. First of all, they're not just for older people. Anyone can get them. Secondly, while spicy food might make things a bit worse for some people, it doesn't actually cause hemorrhoids. And lastly, remember they're really common, so there's no need to be embarrassed. Most cases aren't serious and can be sorted out with a few changes and maybe some treatment from the doctor. Hemorrhoids are a very common condition that many people experience at some point in their lives. The good news is they're highly treatable. Now that you know what causes them, what the symptoms are, and what you can do about them, you're in control. With the right care and lifestyle changes, you can manage and even prevent hemorrhoids effectively. See your doctor if you need to. You can manage hemorrhoids and get on with living your life. Don't suffer in silence. Have you or someone you know dealt with hemorrhoids? If so, what remedies or treatments worked best for you? Share your experiences in the comments below. We'd love to hear from you. If you found this video helpful, please show your support by giving it a thumbs up and subscribing to our channel for more daily health tips. Thank you for watching, and take care of your health.